Hello, I'm Ethan Harris.
And I'm Rachel Concepcion. We are residents at Naval Hospital Camp Pendleton and are excited to share this case report with you today.
Kawasaki disease is an acute vasculitis that primarily occurs in children below the age of 5. There have only been 111 adult cases published worldwide by our literature review. Those affected by Kawasaki disease are at risk for coronary artery aneurysm and myocardial infarction, particularly if untreated. We'll be presenting a rare case of acute Kawasaki disease in an adult male.
A 21-year-old active duty Caucasian male was transferred to our facility with 7 days of fever, fatigue, jaundice, polyarthralgia, rash, and injected conjunctiva. The service member had been stationed in Okinawa and was undergoing tactical training in 29 Palms, California. His fevers had not responded to broad-spectrum antibiotics at the previous treatment facility. We diagnosed him with Kawasaki disease based on his fever duration and characteristic exam findings.
The patient was treated with first-line therapy for Kawasaki disease, which includes intravenous immunoglobulin and high-dose aspirin. He demonstrated complete convalescence. Serial echocardiography and CT angiography demonstrated no coronary artery sequelae. He made excellent recovery and returned to full duty status 6 months post-treatment.
Kawasaki disease is an unusual and likely underdiagnosed cause of acute febrile illness in adults and confers potentially fatal cardiovascular risks if untreated. The etiology of Kawasaki disease is poorly understood despite considerable research.
The diagnosis of Kawasaki is purely clinical and should be considered when a patient presents with a fever for at least 5 days, plus 4 of the following: polymorphic exanthem, lymphadenopathy, mucositis, bulbar conjunctivitis, palmoplantar desquamation, or coronary aneurysm.
Treatment guidelines for adults are the same as for children: single-dose IVIG and high-dose aspirin. The utility of additional immunotherapy such as corticosteroids and TNF-alpha inhibitors is currently under investigation. Our case adds to the literature a rare case of adult-onset Kawasaki disease in a Caucasian with exposure to 2 high-incidence regions.
In conclusion, though Kawasaki disease is uncommon in adults, this case demonstrates the importance of prompt recognition and treatment in a child or adult with prolonged fever and mucocutaneous findings to reduce cardiovascular morbidity and mortality. Further investigation is needed to validate adult diagnostic criteria, pathophysiology, and long-term prognosis.